What's going on, everyone? I just want to do a video showing what I keep in my aid bag. I'm an EMT and a medic in the US Army. This is my current aid bag. This is the RATS tactical aid bag, I believe. I'm not sure the exact name, but it's the RATS. This is what I use for most of my operations. Mainly just covering ranges and things like that. Any obstacle courses or something that I have to be there for, here for that. So a little bit there. This is an outstanding aid bag. There's so many little things that set this bag apart from the rest. So I just wanted to go over that first. If you want to see more in depth without all the equipment in there, I can strip it down and show you guys what that looks like. So it's the RATS aid bag. This is how it comes. The outer portion, I'm not sure the material, but it's water resistant or waterproof, so if this thing gets wet, none of the contents inside is going to get wet. All the zippers are covered and protected from the weather. Got your little Velcro portion here for any of your patches, designation. Outer portion has this buckle that opens up to the main compartment, but under that you have a little elastic band for a tourniquet. There's also a slot there for some trauma shears. So I just keep the regular, these are the cheap version trauma shears. I'm not sure what brand this is, but these are all around. These are your standard trauma shears. So that's securing the top portion, covering the inner contents. I also keep my Raptor trauma shears on the outside. For long or day trips, I usually won't have these with me, just any extra weight that I can lose, I'd rather get rid of it. So if I'm taking this on a ruck with me, wearing it around, I'll usually take that out. Nice little holster stays there. Take these with me. I could stick these on my belt if I want, or whatever, or just take them out entirely. I also keep for redundancies, more cutting options, a seatbelt cutter in here. Good to have. I also have, I think this is called the RATS rescue straps, I believe. Not in relation to the RATS pack. This is a separate item here. Nice little compact pouch. Inside has about 5 loops all looped together for to help you with dragging a patient casualty. This is very useful. Basically just a bunch of loops intertwined together. Bag has a bunch of grab handles to grab onto on all the sides. There's one up top. In the back, nice padded straps. These are not removable, but they are adjustable. Nice breathable padded mesh on the back here. There are foam inserts, blocks that sit on either side. So if you're wearing body armor, your back plate will fit nicely right in this slot if you have the rubber attachments on there. I take them off because I'm not wearing body armor very frequently, so it's a little more comfortable just having the flat back portion. But if you are wearing body armor, this will fit very snug around your back, and if you're walking around long distances, it's not going to be bouncing around at all. It has a waist strap, pretty minimal waist strap down here. I keep it as tight as I can, so I'm not using it very often. Chest strap here, obviously. And the adjustments are all done inside right here. See that? So MOLLE on both sides. This side, I keep my traction splint. I think it's the North American Rescue traction splint. Very good to have. I don't keep this on here all the time. I just spent the day at an obstacle course, and with climbing towers and things, there's always a risk of a fall and a broken leg. So anything I can do is will really help stabilize a fracture to the leg if there are any. Little carabiner with some tape and marking probe, flashing a light here. I like these S carabiners because it fits nicely with a bag of saline, or if you're hanging fluids. The tabs on here are very small and can get in that bag of saline and hold that up wherever you are. You may never know if there's something to hold your bag of saline. You may have someone extra standing there that can hold it for you. You may not. So it's always good to have something to hook on there. Got some zip ties for just in case. Many uses there. Comes with these outer pockets. These are not removable or detachable. These are fixed here. When they're not in use, they flatten down very slim against the body of the A bag. Obviously they're kind of large because I have things in them, so just be aware of that. Something to catch on if you're moving in and out of vehicles. This one I just keep my Easy IO, just because there's not a lot of room on the inside for that, and I keep some extra IV supplies in here, needles, alcohol wipes, 2x2s, things like that. So my IV portion is very packed on the inside, so I don't have room for my IO. This side, I just keep some emergency or things that I would use in for life-saving measures. So I have NCD, some Sharpies, EpiPen. I have a skin stapler if I need that for quick closure of a wound. Alright, so opening up the top portion, actually forgot another outer pocket before I get in there. So there's also this top flap. Good little extra space here to pack things in. Normally I'll keep a ice pack or heat packs up here. I don't have any right now. I just used my last ice pack, so I don't have any. But ammonia inhalants, extra tape, some poison ivy, cream, different extra things, extra IV tubing, extra IV kit, things like that. Now for the main portion. So this has zippers on either side. It also has a nice pull strap, so you can just pull it down with your hand if you need to. And now now for my favorite portion, all the fun stuff. So opening it up here has these nice removable pouches with clear vinyl window on there, so you can easily see what's going on in here. These are all removable, Velcro. You can put them wherever you want. I have mine set up in HABCs or March, basically. So we'll start up top. There's this extra portion here that I just set there. It didn't come with the pack. Put this down. Didn't come with the pack, but keep all my medications stored up in the top there, since this is getting somewhat packed. So different things I keep in here, just some sunscreen, I have Metamucil, Pepto-Bismol, some throat lozenges, some Loratadine, Sharpie. I have some lidocaine patches. There's lots of back injuries and chronic back pain in the military. A lot of times just that little, basically icy hot patch will help alleviate their symptoms for a short time. So some things I keep in here, some nasal or decongestant, dry you up. I keep some biohazard bags in here, some Q-tips, different little medications, some Tylenol, ibuprofen, chapstick, mainly for me. I'm not going to give that out to other people. Another EpiPen. Keep my Carpijet in here if I need it. Normally I would keep some Benadryl in here or Solumedrol. I don't have any right now, but that's another great thing to have in here. So going through in my top pocket for my massive bleeding, I have all my tourniquets in here. I keep some pressure bandages in here as well. I like these 3-inch North American Rescue pressure bandages because they have Velcro at the end, so you can secure that without messing with the little clips. I also do keep a standard 6-inch Israeli trauma bandage. So, same idea, applying pressure there. Also keep some tape and some gloves stored in the back there. Alright. Next pouch down is more bleeding stuff because that's our main concern, is keeping the blood in there. So I have my cravats, 2 combat gauze, 2 compressed gauze, 2 ace wraps, more tape. There's gloves packed behind there, extra ace wrap in the back. So that's all of my splinting, massive bleeding stuff right there. You can easily pull that out and give that to someone or go with it. Up here I keep all my vitals stuff, so very packed, mainly because I keep my nice Welch Allen otoscope in here. Very good for looking in the mouth, nose, throat, ears. Always very annoying for the patient when there's stuff in their ears or they got some pain in there. So you can easily look in there. Keep my pulse ox secured down, stethoscope. I keep some tongue depressors, some more Q-tips in there. I got my blood pressure cuff. I have a thermometer, small thermometer in the back. Keep some extra masks in there as well. Now the only thing that's not secured in the bag is my BVM. So not a whole lot of space left for that. Fits nicely there. It's packed in pretty tight, so I'm not worried about that falling out if I have to move quickly. But just know if there's anything loose in the bag, it's probably going to fall out if you are running around or have to suddenly go to another location. So there's that. That's the main portion. Now for my breathing and airway, just kind of consolidated into one. Have my cric kit. I need to do a emergency cricothyroidotomy. Have a few MPAs, easy stuff there with the lube on it. I have a King LT just in case I need that. I have tape, gloves in here, my NCDs, and my chest seals are tucked in the back. Keep a few chest seals in here, vented and non-vented. Pretty standard stuff there. Obviously our gold standard for Airway is the cric. So I have that if I need it. If I don't want to go as invasive and the casualty is unconscious, I do have that ET tube that I can introduce down there. Now for probably the portion that gets used the most, which is my minor bleeding kit, boo-boo kit basically, and miscellaneous stuff. So keep my ring cutter in here. If there's any snake bites or swelling, burns on the arm or hand, cut off the ring. Love this stuff. Dermabond, great use. Basically, if you know what this is, it's basically medical super glue, also called new skin or liquid skin, different names, but basically very strong adhesive that can close up wounds. Again, in every pocket I keep tape and gloves, since these are rip away. If I am going off alone with one of these pouches to an area, or if I hand this to someone, there are gloves and tape in here, which you usually can't go without. Got my band-aids, some steri strips, alcohol pads, little boo-boo kit there. Have my eye shield, since this is basically a miscellaneous bag. Good spot for that. Got tweezers in here. I have a little suture set that I've put together. Basic stuff, some iodine swabs, all my needle grabbers, needle drivers, skin hooks, my sutures in there, and then the rest is just miscellaneous items. So scalpels, if I need a scalpel for some reason. Have your fun cauterizing pen, I need that. Some suture removal tool, skin or razor if I need to shave anything off to do some sutures. So mainly that's just miscellaneous stuff. I do keep some non-adherent Telfa bandages, Telfa pads. Those are very nice when you don't want to get the fibers of the 4x4 stuck in a wound. So that's it right there. Also in this portion, there's a thin spot for my blanket and some other admin material. So not sure the brand for this. Thermoflect, just a thermal blanket used for your passive warming. I keep a 9-line in here, some casualty cards, and then I like this Maxwell reference guide. There's so much good information in here, leading with EKGs for full body exams, history exams, things like that. Obviously it has an eye chart, which is useful. I actually use the eye chart quite a bit. A lot of times in clinic, if I can't get to the eye chart in our clinic, if someone's using it, if there's a plethora of people and it's backed up, I will sometimes just run out to my truck and get that and bring that inside and use it to assess the vision. So nice little spot right there, and it gets tucked away. So it's there if I need it. And the last portion of this pack, bottom portion, where I keep all my fluids and IV stuff. So not a ton of room in here, so I only keep 1,000 milliliters. So 500 normal saline, 500 lactated ringers, with everything secured onto it, so I can grab the whole pack. There are starter kits out there. This is one type. There's the North American Rescue ones, which are nice. It has multiple needles, saline lock, constricting band, different things. But I find those have too much equipment in there, and when I'm trying to start an IV, I don't want to be searching through all these little items, like not looking for the alcohol pads, I'm looking for something else, and I can't find it because there's too many little things, 2x2s, constricting band, all that stuff. Then I keep my sharps in here, and tape. Keep my tape in every pocket. So that's my aid bag that I use as a medic for my day-to-day stuff. I also have a video on my home first aid kit, if you'd like to see that, with the I haven't posted it yet, but it will be up shortly. I'm also going to do a video soon about first aid kits or individual IFAKs and some tips and things, different models that are around. So that's my kit. This is the Rats Tactical aid bag, not sure the name. One thing I forgot to mention is my splints. Keep a splint on either side. There's a nice sleeve portion there for same splint. So keep one here, one on this side. If you need to make a frisbee or a sword or something on your board, you got same splints there. If you have any questions, let me know. Some tips before I end the video. It's kind of things for setting up your aid bag. So my main tip probably be setting up your tourniquets properly, having the time strip not covering your windlass so you can apply it quickly, and having it preloaded in